What we recognized early on during the pandemic was that we wanted to protect the healthcare workforce. And one of the things that we wondered was whether we could do that by incorporating robotic systems in healthcare environments. One of the things that we set out to do was really understand whether patients would be willing and interested in engaging with robots to help with their evaluation.
That's really something that we're very foreign to. I mean, we've seen it in movies and we've, seen it in sci-fi books, but now here we are in 2021 with robots standing in front of us, providing us medical care services. So tell me what the questions were and how people were responding to them.
Would you be willing to have a robot engage with you or facilitate care, telehealth, essentially? Another one was, would you have robots sort of help you turn over in a bed? What we found was that actually, folks across the nation were overall very willing to engage in robots.
Paint the picture for me. What does it look like? I'm sitting in a waiting room, hoping to see a doctor, and then I have this robot coming towards me. So how big is it? What does it look like? What does it sound like? And what does it actually do in the triage stage?
We collaborated with Boston Dynamics, and Boston Dynamics has previously made a robot that looks like a dog. So it's a quadruped. And so what we did with Boston Dynamics was further sort of retrofit that dog into what we refer to as Dr. Spot, and that has essentially a tablet so that you can see a person's face really at the front end of the robot, and then also some camera systems that also facilitate the extraction or measuring of vital signs from people, from the patient.
Is it dog height? Is it human height? Does it make any sounds? Does it talk to you like, hello, how are you? What can we expect?
It is dog height, so probably a couple of feet off the ground, and there's a tablet, so there's actually a person on the tablet, and so it's actually a healthcare provider that is sitting at some distance, that's protected essentially, that is able to steer the robot to the person and really, again, speak through the controller directly to the patient, and ask them questions as far as, how they're feeling, are they short of breath, if they've had any exposures, for example, regarding COVID. People were actually very positive, and really patients, as well as the general public that we had seen through the initial survey, we're very accepting of robotic systems in healthcare settings, particularly, and this is obviously during the pandemic, and these were patients that were being evaluated for COVID. And, so overall, it was a very favorable response, and really sort of helps inform and gives us motivation to continue to explore application of robotic systems like these in the healthcare setting. Robotic systems really could play a significant role, not only in COVID-19 or during COVID-19, but also even beyond, given sort of the positive reception that we've had through our studies.